We have hundreds of people that are homeless. That can't go on. They cannot go on. This is America. This is not a third world nation. We need food, we need clothing, we need everything you could possibly think of.
President Obama, yes. Please listen to us down here. We are going to die. You don't understand. You've got to get your trucks here on this corner now.
You know, the emotion of it all, you know, seeing people's wedding photos floating, right? Seeing people's belongings and possessions soaked, waterlogged, and intermingled and ruined with garbage and trash.
You know, you can get a refrigerator, you can get a couch, you can get a TV. One of the hardest things was losing the pictures, your memories of your family. You can't replace those.
I lived in a part of Tottenville that wasn't really affected by the storm. After that, I was looking to help other people, since we were very fortunate. We really didn't have anything happen to us or our house. So they were organizing at the church. We were then dispatched to different areas of Staten Island that needed our help the most, and I was sent to Cedar Grove. Once I drove down to Cedar Grove, I got to see some of the devastation and what these people in that area had to put up with. It was quite overwhelming to see.
What we did on day one after Sandy is people were dropping off tons of box lunches for us to help us feed the community. So a few of us, our team, got in a few cars, you know, big SUVs, and we drove through the neighborhoods from basically the Verrazano Bridge to Miller Field, and we went up and down blocks just giving people box lunches. And the devastation in those little bungalow communities was tragic. It was heartbreaking. But the spirit of the families that were emptying out their houses and trying to get back to normal, it was an honor to see how people just responded and how resilient they were.
And I remember being outside trying to salvage pictures and my other daughter's portfolio. And a girl walked down the block and she said to me, "Can I help you salvage that? I'm an architect. I lost my portfolio when I was in school and I want to be able to help you. It will help me to help you salvage this." And so she stayed with me and dried pictures, and we tried to dry them in the sun.
The harder part was the plug-ins to the community, and how could we make sure that in this particular moment where we really did need to be all things to all people, could we provide additional staff support to Richmond University Medical Center? They were seeing a significant additional influx of patients until the following morning when all of our patients came back and things got really ugly.
The day after Sandy, I was part of the reopening team for the emergency department at Staten Island University Hospital. We showed up and we took care of a lot of patients that day that had environmental injuries. That day we saw patients that experienced very low temperatures, being stuck in water for a long period of time, as well as normal things that you would see on a busy emergency room day.
I believe to this day the busiest day in the history of Staten Island University Hospital was the day after Superstorm Sandy. And it was just awful. It was just all sorts of things, from my oxygen doesn't work at home to I had this minor injury trying to help, to all sorts of medical conditions that were exacerbated by trying to protect their property. It was just an awful day. And the people that worked that day will still tell you that they're traumatized about working the day after Superstorm Sandy with how overwhelming it was.
The devastation in my neighborhood was unbelievable. There were people's furnaces on other people's lawns. We saw ice chests from stores that they keep ice on people's lawns. Trees down, out with power. Below the boulevard, people have lost their homes. There is nothing left. They have found bodies down my block. So I know the devastation there is a lot worse. We're lucky we got out alive. He lost everything. I just found his baby book and I started hysterical crying. But until you go through something like this, you cannot understand the magnitude of this.
One thing that we provided early on was shelter for people who lived in the community whose houses were basically flooded. As I walked from my office through the main lobby of the hospital over to the command center, I passed a large number of people and their pets in the entrance to the hospital in the waiting area. They had been flooded out, they had no homes, and they wanted to shelter their pets as well as themselves. So we became a shelter for that period of time for people who lived in the community, whose safest place that they could come to. And by the way, our emergency room was never shut down. Our emergency room was always open for anyone who needed or who could get to the hospital for emergency care.
We didn't miss a beat during Sandy. We remained fully 100% operational prior to, during, and after.
This isn't a question of whether somebody can get the things they need to live comfortably. These people without electricity couldn't live. And the idea that there were so many of them right in that lower section of Staten Island that needed somewhere to go, and the fact that we could accommodate them and essentially plug them into the wall and put them on oxygen, and they could survive until their homes were actually ready. And some of these people stayed with us for a long time until they had a safe place to go.
My mother-in-law was staying with us, so our biggest concern was getting oxygen for her.
We actually, on the fly, set up units where they weren't really sick, that they needed to see the emergency room doctors and staff that were trying to take care of a large amount of people, but we set up areas of the emergency department where we could make people comfortable and ensure that they had the proper electrical needs to charge their phones, for example.
In Connecticut, we're seeing the same type of damage that you're describing in New York. Lots of downed trees. This was a very severe storm. Right now, we have just over 480,000 customers without power, but our crews have been making good progress. They've restored more than 100,000 since this storm hit.
I was called to the waiting room because there was a young woman who had a young son who suffered from seizures and was out of his seizures medication, and she was completely overwhelmed with not being able to get these prescriptions. How was she going to take care of her son? And I called on Dr. Kordakovsky just to brainstorm because, you know, of all the things that we experienced and what people needed, this was new. And we were able to secure prescriptions for her through the hospital so that she had enough to go home and take care of her child. She was so overwhelmed. She came back to us about 6 months later and actually worked for us in the emergency department as a patient liaison just to give back to the community.
Our biggest problem at that time was platooning our staff, because the staff that was there for 4 or 5 days. The staff that wasn't there couldn't get to the hospital. Staten Island was locked down for a good 4 or 5 days after Sandy.
Today, when the snow started coming, people were in there having meals. And one thing I want to tell you, Brooke, is that we actually had a storm-related injury. But what happened to Albert was he raised this up, and there was so much snow on it, it came down, and the corner of it hit him in the head, and he was gushing blood. We took him to the hospital. And I give a shout out to the Staten Island University Hospital. Within 15 minutes, you never hear this, he's in the hospital. Within 15 minutes, he's out with 6 stitches in his head. He is doing okay, we're happy to say.
So platooning our staff, keeping them fed, keeping them healthy, and also balancing that with, you know, what's going on with their families.
Gasoline was being distributed at the Armory on Manor Road. There was a disturbance and there was some violence that occurred. The hospital was called upon to make certain that we were able to supply fuel to people who resided in Staten Island, especially those people who were involved in healthcare, because it just wasn't the employees of Staten Island University Hospital that needed to have gas in their cars to get to work. It was also the employees of Richmond University Medical Center, the employees of the various home care agencies, the Visiting Nurse Association of Staten Island, and that Staten Island University Hospital would be happy to provide the security needed. But I did not want the services providing to our patients during that period of time to be disrupted in any way. So with the aid of the New York City Police Department, we were able over a period of about 2 weeks to provide gasoline.
I was also standing outside and I had sandals on and it was freezing, and a girl came down the block and she handed me a pair of used sneakers. I put on someone's sneakers and was happy to be able to have something to be warm.
So we were affected by the storm. My whole family sheltered in place at my brother Anthony's house, which is down in Newport Beach, 4 or 5 blocks from the water. My mother is 5 houses down from him. Her house got wiped out. She had 9 foot of water in her basement. He didn't get a lick of water in his house. The wave just seemed to go around him. So my family was fortunate that they picked the right house to shelter in. And a lot of our employees went through the same exact thing.
I think we all know as healthcare professionals, as healthcare leaders, that when we take jobs like this, it's really your whole family signs up for these jobs. And the reality is, one of the things that my wife knows is when these kinds of events occur, I'm not going to be home. I'm going to be at work making sure that I can do what I need to do to protect the people of Staten Island. When you do these kinds of things, it's really a family commitment, not just a person commitment.
We also asked our employees to bring in supplies, to bring in clothing, canned foods, non-perishables, anything that we could use to help people in the communities that could not get to the store. We even searched for housing across Staten Island for individuals who had lost their houses.
Everybody was so supportive. I can't say enough about the amount of support that was given to me by my coworkers, the hospital. So many people just showed up at my house and tried to help us clean, brought us cleaning supplies. Coworkers gave me clothes because I didn't have any clothes. My husband didn't have any clothes to go back to work.
The type of work that we were doing in Cedar Grove was mostly the houses that were overwhelmed by the flooding. We were taking out the sheetrock and things that would get moldy, and we were using different chemicals to put on the wood.
The hospital gave all of us gift cards to Kmart to at least get something to be able to be a little bit normal, to feel better.
And we opened a store, north and south, for individuals to come to those hospitals. When I say store, it was a store without any cash registers. So anyone who needed food or supplies or clothing could actually come to the hospital and take whatever they needed in terms of getting through the next couple of weeks.
Some of the very basic things that we all take for granted, but a lot of us don't have right now. So it's important for us to try to help each other. We're doing this for our employees, the same people who lost everything, who came to work, to make sure that our patients were taken care of.
Whether it was clothes, a pocketbook, plates, anything that you needed, they brought, if people were donating stuff, they brought it to your house. There was just so much, it was just so everybody just came together. It was, I can't say enough for the amount of help that we were given. Staten Island Hospital, we're a family. We look out for each other.